They call trigeminal neuralgia a suicide pain. It is genuinely one of the most severe pains you can have, that affects people on earth. I have fixed that in my office 6 out of 6 times so far. And the longest it's taken me was, I think it was 27 minutes, and that lady had it for 17 years.
Michael, thank you so much for coming on the show.
You're so welcome. It's always great to see you and talk to you.
Yeah, so I want to talk to you about headaches, migraines, and trigeminal neuralgia, because these are, conditions that plague so many millions of people, and there really aren't a lot of viable solutions to really address the underlying root causes of these conditions in the traditional, mainstream conventional medicine. So talk to us a little bit about, what the underlying root causes are of these issues.
Oh boy. I mean, it can be a combination of things. It's been my experience that there's either an electrical, energetic blockage of some kind that could have been caused by any number of reasons, toxin exposures, long-term things that have been in people that I found when you remove them, suddenly their headaches go away, and all sorts of other things too. Emotional issues are huge. I know, like, for instance, trigeminal neuralgia, for those who don't know out there, that is one of the most severe pains. I think they compare it to like a broken femur, and even worse than giving birth. Like, I know a couple of women actually that I've done this on who have given birth naturally. And they say the pain is not comparable. Like, they would give birth 10 times a day in order to get rid of the trigeminal neuralgia pain that they were experiencing on a regular basis. And no amount of drugs these people are taking morphine and fentanyl and these crazy poisonous drugs that are killing so many people. But they don't know what else to do, because it's been there for so long for some of these people. And they call trigeminal neuralgia a suicide pain. It is genuinely one of the most severe pains you can have, that affects people on earth. I have fixed that in my office 6 out of 6 times so far. And the longest it's taken me was, I think it was 27 minutes, and that lady had it for 17 years. And other ladies, this other lady had it for 10 or 12 years. Another one was affected for me. It was only 5 or 6 years. And hers was, what considered not to be that bad, at only about a 5 or 6 out of 10 on a pain scale, 10 being a broken bone, every day of her life. I mean, these people wake up with it and go to bed with it. And some people can't sleep, so their adrenals will start to shut down. Hormone issues will start to arise. I mean, no sleep. That's how they torture people in the military from time to time,
Yeah.
So that's not a good thing. But I know someone personally very well that had this. She's driving along, minding her own business one day, and it went on like a light switch. And she told me that it was like someone was taking a blowtorch and hammering her face at the same time. The trigeminal nerve kind of comes up and spider webs through both sides of your face, and so a light breeze will set these people on fire to where they'll just start screaming, and this woman that I'm talking about now had 3 children naturally, and she's only about 5'4". She's a small person, had plenty of injuries, broken bones and things playing sports growing up. She had passed 8-millimeter kidney stone at one point. That was, excruciating, obviously. And she said none of these even scratched the surface on the pain for the trigeminal neuralgia issue that came up. And again, they were giving her IV morphine, and it was not hardly doing anything. And this is a natural medicine lady. So is her mother, and so is her grandmother. And so they were trying everything under the sun. And she is an emotional release practitioner as well, and a successful one. She had, was trying everything in their bag of tricks, talking to every doctor they knew, and really, it was really hardly making a dent. And she had actually told me she had considered suicide at one point. And this is an extremely happy person, So anyway, she had gone to see a doctor, a friend of ours, Dr. Lee Cowden, who she told me, and she told me this story herself, had walked up to him, and he knew why she was there, a muscle tester and found out that it was a trapped emotion in her colon that was tied to the same tooth as the trigeminal nerve. And that's what was affecting it. And so she had gone off and into like a quiet corner because it was this medical conference where she had gone to see him earlier than she could get in as a patient. And so she went off to herself and did some, like, I think it was a motion code was the procedure she used, the modality. And 30 seconds later, it was gone, to zero. So, and my point is that there's usually several contributing factors to that kind of pain, and things like migraine headaches, that are chronic on people. So it really comes down to just kind of finding out what the main driver is. But I have been able to, through detox, several different types, either lymphatic therapy or laser energetic detox, which brings a lot of people from all over the country to me into my office just for that procedure. Or Equiscope is another thing I use, which is just correcting energetic electrical flow in the body in various areas. And that's phenomenal. I mean, I can count on literally one hand the amount of times, maybe 7 fingers, the amount of times that I've failed, to get where I wanted to go with people. In the over 2.5 years now, I've had my office open. So fixing and being able to identify where those electrical and energetic blockages are coming from is pretty important. And so far, like I said, I've been able to fix trigeminal neuralgia 100% of the time. I would never make a statement like that, especially for something so severe.
Yeah. And I came into your office in St. Louis. I'm a good friend with you and your dad and Michael Rankin Sr. And I flew into St. Louis to your office, and you guys did the works on me. You did the lymphatic drainage, you did the Equiscope, and were testing me before and after with software to see the efficacy of, how much all my various markers improved, heart rate variability and meridians and chakras and all kinds of other brain waves, all kinds of other variables. And you can see the improvement before and after all of these different modalities that you're using. And I was really, really impressed with the Equiscope. And it's you did that like up and down my spine. You were doing things on my teeth to help with things on my jaw. You did a lot of different things to reestablish and improve, like you said, electrical and energetic coherence and function and flow. And some of the stories that you have told me of people recovering from decades of pain and other stories have just been absolutely phenomenal. Can you tell me some about migraines and headaches?
Oh, sure. Yeah. I honestly, Wendy, I wouldn't believe 10% of this stuff if I hadn't seen it and done it. I barely believe it. And I did a lot of this stuff because just, it sounds so strange when you've got, and I think I mentioned a couple of these to you before, the migraine, because I do now get quite a few people coming in with migraines. I've had them from coast to coast come in, they'll see one of the testimonials or something. One lady, I can't believe I didn't get this woman on tape. I didn't even think about it, but she had had a headache every day for 40 years. Literally all day, every day of her life. They would turn into migraine a quarter to a third of the time. They were blinding. They would literally affect her vision in a very significant way. She'd start vomiting, wouldn't be able to eat. All that happens to a lot of people with severe migraines like that. And that's not even what she came in for. I don't even remember what it was, like some neck pain or something else. And I said, well, what's going on? She's like, well, I've got this headache, but you can't do anything about that. I was like, well, why? How many doctors have you seen? She's like, I stopped counting at 80. And that was 5-10 years before. Right. And I was like, well, all right, let's just see. And I literally just stuck a headband on her, and she said they were mainly front forward whenever they came on. I was like, well, okay, that makes sense. Let's work on that area then. And I did. And literally it took me, I think it was less than 6 minutes. And she was just so dumbfounded. I said, well, your pain, she told me it was like at a 4 or 5, I think that, before. And she had to think about it, and that happens a lot when people are in that kind of pain for that long. They don't recognize not being in pain when it's been for like 10, 20, 40 years. it just, this is a really, this one kind of floored me. And it really, these days, it takes a lot to put my jaw on the floor, because I've seen such crazy stuff so many times. But this woman, God bless her heart, she had a rheumatoid arthritis diagnosis when she was 16 years old. And when she came to see me from Florida, she was in pain every single day of her life. Okay, all day long. It would move to various joints. Sometimes it'd be more focused in the lower half, in her knees and hips and ankles and things. Other times it'd be in her neck and shoulders, every moving joint, which is pretty much what arthritis affects. She is 77. When she was 77 years old when she came to see me. So she's been in pain every day, all day for 61 years. I mean, no joke. Never had a break, not one day, not 1 hour. It would go up and down. Like a good day for her was like a 4 on a 10 scale. Again, 10's a broken bone, right? And so that would enable her to get out of the house. And she's a very strong woman, not a complainer. She only been through like 5 or 10 doctors, I think. And most people like that will have gone through 100, but she was just like told there was nothing they could do. And so she said, okay, it's just something I have to live with. And I mean, she in 61 years, she's missed weddings, Christmases, funerals, birthday parties, stuff no person would want to miss. But and this is a very strong lady. But it took me about an hour, less than an hour, actually. I think it was 55 minutes. We clocked it because I couldn't believe, she was another one. She's like, I'm like, so how do you feel? And she was like, well, and she starts moving things around, and she goes, well, I don't have any pain left. And I was like, really? None? And I had made her stand up and move around, and she's shaking her head. She looks down, she looks up at me, and she's like, Michael, I have no pain left. And I was like, and how long has this been? She's like, it's over 60 years. I go, would you mind saying that on tape? Because I don't think anybody's going to believe that.
I know you have a lot of testimonials of people being recorded too on your website. Can you tell us your website again?
It's painfreelifellc.com, painfreelifellc.com. If you go to the media page, that will bring you over to the YouTube channel. I moved them all over to the YouTube channel because it was slowing down my website. So yeah, there's probably, I think there's close to 30 of them on there now. And honestly, Wendy, I didn't even, they turned out to be a wonderful marketing tool, but that's not why I started doing it. I legitimately did not think anyone would believe what I was doing. And so that's why I started doing it, because I am a true skeptic of pretty much all things. And so I have to see this stuff with my own eyes. And so if I won't believe it, I know a lot of other people wouldn't believe it either. So I just tell people all the time, because I can tell a lot of times when I'm telling people that, this person has had a headache for 40 years, or this person has migraines 48% of their days, and we stopped it with light and frequency. I can see in their face that they're listening, but they're not really believing me. And so I'll tell them to just, you don't have to believe me. Go here and see if you believe these people, because either they're telling the truth or I should start some kind of acting agency, because I've got Oscar winners, everywhere.
Yeah. And it's, I think it's important for people to be open, when they have different types of pain, because when you go to a conventional doctor, they're going to offer pain medication, which will have only hope to cover up symptoms and not address the root cause. Or surgery, perhaps, and that it typically ends in disaster, where people not only don't have resolution of pain, they have more complications.
It'll get worse.
Yeah, it gets worse, or nerves being cut, or just mistakes and things like that. I've heard of horror stories, and typically doesn't work. And so, and I love that you guys work on, or that you work on emotional trauma as well, because we know in the research, 65% of physical health issues are from emotional trauma. And that's a significant, and the medical doctor's not addressing that.
No, and I believe it in my heart, because I know a lot of medical doctors, I know some really good ones, and I've met a lot of people that I would let them prescribe me a glass of water, even though that's what most people are low on. I mean, they are, and I say this, gently to any medical doctors that might be listening, especially the newer ones who are just getting out of medical school. They are catastrophically undereducated, and because they are only taught drugs. Big Pharma took over our medical schools, back in the 20s, and it took them only a few years and about $100 million, which is, they'll make that in an afternoon now. And so, a lot of them, either they don't know or they're scared to do anything else because they don't want to risk their medical license and the years and years of school and hundreds of thousands of dollars they've invested in their education and setting up a practice and all this stuff. We know doctors, Dr. Lee Cowden has had his medical license taken away a couple of times, and he's just stopped even bothering with that years ago for prescribing vitamin C for people, for high-dose vitamin C for people, and various other reasons. He's not alone. There's hundreds, thousands of doctors.
Yeah, and right Dr. Lee Cowden is Dr. Mercola's personal physician. He's an incredibly well-respected medical doctor, respected by everyone that I know in the alternative health community.
Yeah, I go to a lot of Dr. Cowden's seminars. I mean, I learned a lot of things in school, but all the things that I use to actually heal people in my office, I got from him and ACIM, Academy of Comprehensive Integrated Medicine, and the group that he's put together with, I've learned muscle testing from Dietrich Klinghardt. Joe Mercola came in and did a couple talks on things. I mean, Norm Shealy, arguably the most famous neurosurgeon in the history of mankind. I learned bioenergetic therapies from him, like personally, amongst 10 other people. I was really grateful for that experience to learn those kinds of things. That's where I learned laser energetic detox, which I use for everything from chronic migraines to autism, allergies, asthma. I am not treating any of these, for the record out there, anybody who might be listening. But when you start to remove certain toxins, whether they are physical, whether they are emotional, when you correct energetic flow in the body, these things just kind of fix themselves. I mean, your body is a perfect machine. It's only things that we do to it that will make it not function the way it's supposed to.
Yeah. Can you talk a little bit more on how you address emotional trauma, or how you kind of test for emotional traumas and address that in the body to get to the underlying root cause of migraines and headaches and trigeminal neuralgia?
Yeah, sure. So, and like I said, I mean, it's in my experience, just to be clear for everyone listening, like I myself fixed trigeminal neuralgia, or the symptoms of it anyway, with just correcting electrical flow in the body. And literally it's 6 out of 6 times. And this is something you're not supposed to be able to fix. I mean, only 10 years ago, they started drilling a hole in the side of your head and severing that nerve, which only works for the pain about 30% of the time. If you look it up, anywhere from 20 to 30, depending on what you read. And then your whole face is completely numb. So that is a terrible, terrible option, So like I will start off doing electrical energetic correction on people. And if that doesn't work, I'll say, okay, we're going to shift this over. And a lot of times they might have gotten to that point from an emotional standpoint anyway. But what is that doing? People have to understand, what is that trapped emotion doing? It is creating a frequency, like a ping in the body, like a little zap that will create inflammation, right? Which will stop blood flow, electrical flow, oxygen flow, which is kind of like the root of all disease. So it's getting to where is that? So you asked, how do we do that? One, Dad does most of that work. I mean, I'm learning it, but I've got Babe Ruth, so I use him because he is truly gifted and remarkable at getting to the root of things. I mean, most of the people we both see have already been through, at a minimum, 10 doctors, sometimes upwards of 50 or even 100, literally. And even they've gone through some emotional release, different practitioners, there's recall healing is a real popular one, emotion code, a real popular one, eVox, kind of pioneered by Dr. Cowden as well. Dad really uses all three of those and kind of incorporates most practitioners I've met who who use one, they'll focus on one modality, and that's their specialty. Dad is fairly impatient when it comes to getting rid of symptoms on people, especially severe pain, because he deals with a lot of very serious critical illness and cancer. Like, that's been his passion for more than 15 years. And with that comes a lot of pain typically. And if they are focused on like an 8 out of 10 pain in their liver or their pancreas or wherever, then they're not really able to focus on anything else. If you've ever been in serious pain, or if anyone's been, if you understand what real pain is, some people don't. They never had a broken bone before, but most people do, and it won't let your body or mind focus on another thing until you deal with that. Or again, to go back to if they're dealing with a cancer issue or some kind of very, long-term chronic illness that doctors are having trouble finding out. If you get to the emotional root, a lot of times I had seen with my own 2 eyes. I've talked to these people myself, or frankly, I probably wouldn't believe it, Wendy. They've gone through 50 doctors, they've tried 7 different types of emotional release work, and they just haven't gotten there. And they'll come do an hour with Dad and be like, oh, it's this, this, and this, before we've even done any tests. And, oh, it's your grandmother, it's your mom, your husband, whatever. And we'll address that and go from there. It depends, because if they don't have a will to live, if they don't have a will to get better, and that we see quite a bit, and it's not necessarily a conscious thing, but it will subconsciously, it's feeling a need for them for some reason. Maybe they're getting attention. That's how they got attention from mom and dad when they were little, and that's carried through their life. Maybe it's keeping a spouse or a boyfriend or a girlfriend, or, in their mind. That's what's keeping them there. They're afraid if they get better, they'll leave them. And, frankly, sometimes that might be the case, but, what are you sacrificing for that?
Yeah. I mean, people definitely do get payoffs from being sick, and not everyone is ready to get better. I mean, that's just right. the facts out there.
You're absolutely right.
So is there anything else that you wanted to add to this conversation about pain? I mean, here at Myers Detox, we focus on detoxification, and, we also work on emotional trauma. But when we ever have someone that's really, really sick, or they have cancer or severe pain or something that's out of scope of our practice, we send them all over to you guys, because you and your dad, Michael Rankin Sr., you guys are bar none the experts on pain. You have the tools to address the underlying root causes to banish that pain forever. And your dad works on the cancer aspect as well, and is fantastic at that. And so we refer everyone to you guys as the experts in that field.
So I know you wanted to focus on some headache stuff today, and pain that affects, like trigeminal neuralgia, affects the head too. And people will think it's a severe migraine, only the pain is much, much worse. A young lady. I mean, it's all over the board. It's generally a combination. If you're talking about chronic migraines and chronic headaches, it has been my experience, and I've dealt with, I don't know, probably 40 or 50 of those by now over the years. Because once you do, fix somebody's migraines that have been there for like 20 or 30 years, that, inspires a lot of people that there's more hope there. And so that's why I get a lot of those headache stuff. I had a lady, I think it was for 8 or 10 years. This was like 4 or 5 months ago. But I was talking to her husband, and he says, hey, would you want to do a trade for something for my wife? She's got these migraines, and I saw one of your testimonials. Do you think you can help her out? And I'm like, well, I've yet to fail really to help people with migraines, so sure, send her on in. I worked on her spine, and I worked on she got these temporal issues, and so I worked on this area, and I worked on her spine, and she has had one migraine, I think, in the last 6 months. Another lady that came in had it was neck pain that emanated back here, but it would run up the back of her head and cause these migraines kind of on the top and the sides of her head for, again, years. This was going on. And so I really just took this probe to, it has a positive and a negative, and worked on that area. There was an injury, like a whiplash sort of thing that had happened. And she was going to chiropractors and acupuncturists, and they just weren't getting the problem going. And so I just worked back there to help that energy flow go back up into that neck point. And as I told her to call me if she ever texts me or something, if she has gotten a migraine. And it's been 3 or 4 months now, and I haven't heard from her. So that was, pretty cool. Again, to come back to it, it's usually a combination of energetic problem and a toxin problem. So you mentioned lymphatic therapy. I do use a photon sound beam that goes really, really deep to get that stuff, like that light massage is good for a lot of things, but the lymphatic system is so delicate, it gets squished. Most of it, the 70,000 miles, give or take, is about, in a human body, is about the size of a human hair. And when you press it down too much, it'll stay that way. So you're not really going to move stuff. But this thing it pulses electromagnetic frequencies through these glass tubes, and it will force those things open, so then I can move through toxins in a pretty significant way. The laser detox, I think I mentioned several of these the last time we talked, but one lady who had migraines since she was 12 or 13 years old had gotten a bunch of hair perms, and we had done a bunch of energetic work, and we cut her migraines in half. She tracked them. It was 48% of her days, because she kept a diary for many years. And so we had cut them in half right away. We tracked it over like a month or 6-week period. And then we kind of plateaued, and it kept coming up as I muscle testing her and things that it was a toxin problem. So I was like, you know what? Let's try laser detox and see what happens. And that was the next day. And this is the first time this had happened. She called me and said, hey, I just went for the morning bathroom break, and all of a sudden there was this overwhelming smell of hair perm solution that we had extracted, and she hadn't had a perm in 16, or no, I'm sorry. She was 15 or 16 the last time she had one. She was 41 then. So it was like 25, 26 years that these have been trapped in her body. And I've extracted things from paint fumes to gasoline, oil smell. I had a young lady in my office. She had a diagnosis of celiac and Lyme, and it had caused her kind of head to toe pain. That's what they told her anyway. And she was getting migraines and stuff like that too. I laser detoxed her, and I did, got her out of pain in about an hour, maybe an hour and a half. It was head to toe. So it was a lot of stuff to do there. If it's isolated, I can usually knock it out in 5 or 10 minutes. She had driven from like 5-6 hours away or something. And so the last thing we did, because you got to be off electronics for 25 hours, is I lasered her. And because we do the scan, I identify the things that we want to target that are most important for her body. And she left. The next day, I get a call from her, and she's young. She's like 32, 33. And she's like, Mike, she's like, I always tell people, be mindful of any kind of weird chemical smells that might come out of you, because that's very common, because don't let it freak you out. I want to know about it if it did happen. She's like, Mike. She's like, and it was only hours. A lot of times it's the next day, but this had been 3 or 4 hours, and she was outside. She wasn't even enclosed in a small space, So outside, her and her husband are walking around, and she kept smelling chemical fertilizers and manure, right? For hours and hours afterwards. So she kept turning to her husband. She's like, don't you smell that? Can't you smell that? And she grew up on a commercial farm. Her parents had like 1,000-acre farm where they raised cattle and pigs and used chemical fertilizers. And so that's what she was, and we found that a lot. People that even grow up near farms, they will have those same kind of chemical fumes, because they're spraying it either from an airplane. A lot of times that's what they do. It does not all land on the crop. Okay. If you're within, say a quarter-mile radius, you're going to be inhaling that stuff, and that's on a not windy day. So yeah, gut issues too, same thing. Toxin, a lot of time a toxin problem. But for instance, I had a young woman, 34, 35 years old, who's had uterine pain for at least 20 years. I think she told me 18, 20 years. And we got rid of that in, 15 minutes. Literally, I just started working the energy around her stomach with a positive and negative polarity through a few different frequencies I muscle tested her for, and it was gone. And to my knowledge, it's still gone. And this was a good 4 months ago.
Yeah. And I really love the lymphatic drainage that you're doing as well. What's it called again? The photon beam?
Yeah, photon sound beam.
Yeah, the photon sound beam for the lymphatic drainage, because when I came into your office, I flew to St. Louis to come in. I had a lot of weight on me that you guys had figured out through doing a Zyto scan that was lymphatic fluid buildup, and I thought I just gained a bunch of weight from stress or COVID or whatnot, and it was just I had a ton of lymphatic fluid that just wasn't able to drain. But for me, it was a emotional trauma thing where had my ex-husband. I was with this person I didn't want to be with. They were invading my territory. And if you have like an emotional trauma around territory invasion, it can cause lymph blockage. Yeah. And so you guys were able to release that. And I came in and did the physical photon sound beam to help flush my lymphatic out as well. And I lost like 8 pounds over the next month following that appointment. It was crazy. It was crazy. I was very happy about that.
Yeah. Well, and here's a fun side note for people that a lot of people don't know. So lymphatic fluid, it's called interstitial fluid. It should flow like water, right? That's the normal consistency of it. However, all sorts of things can throw that off and make it gelatinous, so it will not move freely, right? And then you get your concentration points, all the God is so smart. It's all in all the areas that bend and pump. That's what moves your lymphatic system, is movement. So interestingly, if your hormones are off, right, that will make that fluid gelatinous and not flow as well. And as a catch-22, if your hormones might be working fine, but if there's something else, maybe your diet's throwing off, maybe it's an emotional problem that's throwing off and making it gelatinous, that will then also, throw your hormones off. So it's kind of one can react with the other, of many, many things. Those just, it's been my experience, are some pretty prevalent issues. And so many people have hormone issues, because they are breeding iodine and minerals out of the food. I mean, they literally have patents on this to make the mineral content of, say, broccoli less. Why do you think they might do that? There is no reason. It does not help them grow more food. It doesn't help it grow faster, right? I mean, what is the point of that? One could speculate, since, there's, I don't want to get our thing blocked, but let's say this pharmaceutical company owns this chemical company that's responsible for producing about a third of the world's food. They're owned by the same people. So I don't know, call me a crazy conspiracy nut, but that doesn't seem logical to me.
Yeah, or that minerals are needed to run our entire body and our nervous system, for it to run correctly.
If you have no minerals, you're not conductive. And if you're not conductive, no electrical flows go in your body. And we are electricity. We run on it. Most people know that. They figured out we run on picocurrent, which is a trillionth of an ampere. A couple guys got a Nobel Prize for that. I think it was in '91. So if if you're not conductive, very few things will work right in your body.
Yeah. Well, Michael, thank you so much for coming on the show and enlightening us on, how to address the underlying root causes of pain. You guys, you have so many different modalities to address pain and address it quickly and successfully, so people don't have to keep coming back and be dependent on you. I absolutely love the work that you're doing. I think it's really important for anyone, if you have chronic pain or you have a loved one in chronic pain, to give Michael a call. It's a free phone call. Why don't you tell us how to contact you and how to work with you?
You can reach me at 314-899-9535. That's 314-899-9535. You can email me at painfreelifestl, that's Sam Thomas Lima, short for St. Louis, where I am. So painfreelifestl@gmail. If you're, not wanting to talk, you can actually text that 314-899-9535 number as well. It's a work cell phone. Yeah, I mean, you can go, there's a chat box on the website, painfreelifellc.com. There's a little chat box that pops up. You can start talking to me. I have that wired to my phone. So I keep it open pretty much all the time, because I've had people calling with emergencies. They'll get on the website at like 10 o'clock at night. And if I'm not doing anything, I'll answer them. So yeah, anybody can call. It's a free call. I'm happy to, because I genuinely enjoy this work, Wendy. I really, really do. It just floats my boat. I spent so many years trying to work as little as possible for as much as possible, and now it's kind of just the opposite. It's really, I have so much fun doing this. I can't imagine doing anything else now, literally, genuinely.
Fantastic. Yeah. And I love the work that you guys are doing. You guys have helped me tremendously. I'm a patient of you guys, of you and your father, Michael Rankin Sr. And I think you do incredible work and will continue to do so. So guys, I highly, highly recommend you. These are people that I use personally and work with personally. I flew to their clinic in St. Louis. They have the best tools, most high-tech, cutting-edge stuff. And highly recommend. So everyone, thanks so much for tuning in to the Myers Detox podcast. I'm Wendy Myers, and we have over 400 podcasts. So I just surpassed that a couple of weeks ago.
That is so cool.
I know. I'm amazed that people keep listening.
We love your podcast. And so many people I know, I get calls from these interviews, and they're like, oh yeah, I've been listening to Wendy for years and years. And, and so you've got quite a nice following. And I've listened to plenty of your podcasts. They're awesome. So much great information delivered in such a short time. It's awesome.
Yes, thank you. Because I feel so blessed. I mean, I love what I'm doing also. I wake up every day just so excited to help, teach people how to address the true underlying root causes of their health issues and feel better. That's really what, for me, when I was a patient and I felt like crap every day and had no joy in my life, I wanted to figure out, what do I do? What do I need to do to feel better? And I was doing so many things and it just wasn't working. And so that pain is born of that passion I have for this is born of that pain and trying to help my own health issues. And it's so fun and continuing to learn from experts like yourself. And there's so many more conversations I want to have with people. So I just want to thank everyone for tuning in every week and really, enabling me to continue to do this work. So thank you so much.
Yeah. Awesome. Thank you, Wendy. You're great.
Thank you. So everyone, I will talk to you guys next week.
The Myers Detox podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guests' qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.